Do you frequently feel like your neck is swollen or painful, especially when you touch it? Or maybe you've had a fever for days with no clear reason. Imagine you're a student studying for exams, feeling tired, and suddenly you notice a lump on the side of your neck. You panic, thinking it might be something serious like cancer. But what if I told you there's a rare condition called Kikuchi-Fujimoto Disease, also known as Histiocytic Necrotizing Lymphadenitis, that causes these exact symptoms, especially in young adults, and it usually goes away on its own. This disease mainly affects the lymph nodes, especially in the neck, and though it sounds scary, it's not cancer. It's like your body's security system, the immune system, overreacts and causes inflammation in the lymph nodes, which are like small checkpoints in your body fighting infections. Now you might ask, what causes this overreaction? Well, scientists aren't 100% sure yet, but many believe it could be triggered by a virus, maybe something like the Epstein-Barr virus, the one that causes mono, or the kissing disease. Think of it this way, after you get a cold or flu, sometimes your body keeps fighting the ghost of the virus even after it's gone. That leftover fight might mistakenly attack your own lymph nodes. Some experts also think genetics play a role, meaning if someone in your family had a similar immune reaction, you might be more likely to get it too. But it's not contagious. So no, you can't catch it from a friend who has swollen glands, even if you share a drink. Have you ever had a fever that just wouldn't quit for over a week? Or felt so tired that even texting back feels like a workout? People with Kikuchi-Fujimoto often feel exactly like that. The most common sign is a painful or painless lump in the neck, usually on one side. It's like having a small marble under the skin that doesn't go away. Some people also get night sweats, waking up soaked, like after a gym session you didn't sign up for, weight loss, or a rash. But here's the good thing, unlike serious illnesses, most don't get very sick. You won't be on a ventilator, but you might miss a few classes or work days. And believe it or not, some people mistake it for tuberculosis or even lymphoma, a type of cancer, which is why seeing a doctor is super important. So how do doctors figure it out? First, they will ask about your symptoms and feel your neck. Then they might order blood tests. But here is the twist: blood tests often come back almost normal, which is confusing. That is when a doctor might say, we need to check the lymph node itself. This means a small surgery called a biopsy, where they remove a tiny piece of the swollen lymph node. It sounds intense, but it is the only way to confirm Kikuchi-Fujimoto. Under the microscope, doctors see a unique pattern: dead cells and immune cells hanging out together, but no signs of infection or cancer. Scary looking, but not deadly. As for treatment, surprise, most people do not need strong medicine. Since it usually goes away in weeks to months, doctors suggest rest, drinking water, and maybe ibuprofen for pain. Only in rare cases, if symptoms are severe, do they use steroids, kind of like telling your immune system to calm down. Can you prevent something we don't fully understand? Honestly, not exactly. But think of it like this: strengthening your immune system is like upgrading your phone's software so it runs smoother. Eating healthy food like veggies, not just pizza, sleeping 7 to 8 hours, managing stress, yes, even during exam season, and staying physically active can all help your body react better to bugs. While none of this guarantees you won't get Kikuchi-Fujimoto, it lowers the chances of your immune system going haywire. And remember, no, wearing a mask or avoiding cold drinks won't stop it. It's not caused by cold weather or bad habits. Even though this disease was first described in the 1970s, scientists are still learning. Recent advances include better understanding of how immune cells behave in the lymph nodes during this disease. Some researchers are using advanced gene testing to see which parts of the immune system are overactive. There's also growing awareness among doctors so that fewer people get misdiagnosed with lymphoma or TB. In Japan, South Korea, and increasingly in Western countries, doctors are now quicker to consider Kikuchi-Fujimoto in young patients with swollen glands and fever. Some studies are even exploring whether monitoring certain proteins in the blood could help diagnose it without a biopsy in the future. Imagine just a blood test instead of surgery. That's hope in progress,